100,000 people have contracted the virus since it was first detected in the country 2 months ago. For more on this, we're joined by Francesco Paolucci, a professor of health economics and policy at the University of Newcastle and University of Bologna. Thanks very much for joining us. So, can you describe what the country has been through over the past 2 months?
Good evening, Andrew. Yes, it's been a real challenge for Italy. I would say that many would describe it as a dramatic turn of events, and in some areas compared to wartime. Definitely, the picture in Italy is not the same in every region. In fact, the most affected areas, as you probably know by now, are in the north, so the richer part of the country, and many consider this to be one of the positive aspects, although now new evidence is coming up criticizing how the outbreak has been managed from the very beginning, in particular the surveillance strategy and the response by the private sector was not completely, let's say, as quick as we would have expected in responding, in particular in Lombardy. Obviously, you know, the death rate is going down. Also, the infection rate is going down. You're right. It's consistent. According to the National Institute of Health, actually, these figures are reassuring. And however, we are still far from the peak, at least 1 week. So it is important to manage the festive season very carefully.
Do you feel as though Italy is turning the corner in this crisis? You mentioned the infection rate is slowing. Why is that? Are you seeing the effects of social distancing?
Well, yes, I think Italy has taken the most drastic measures compared to other countries that have even better, they've had better results, like, for example, South Korea, which was more effective, in fact, in tackling the outbreak. Probably the virus in Italy was already there for some time. And obviously, the policymakers in the very beginning were battling and debating and sometimes even fighting about what kind of measures to introduce. There were a lot of contradictory messages in the communications, which I think have confused the population in some regions, which has then led to an escalation in the lockdown measures. Now, in recent weeks, people have behaved extraordinarily well with the toughest restrictions, even including new criminal charges for pandemic crime. In fact, up to 5 years reclusion, as we're starting seeing in other parts of the of the world, including Australia. I would say that in the coming weeks, this will continue. Obviously, it's not clear what will be the exit strategy. And frankly, if you look at moves by the Italian government and some of the northern regional governments, you can really see that the measures are even more tight. For Italians now, it's in some regions impossible to get out of the house without a mask. For example, to just walk around the block and so on. So clearly, these measures are paying off, but they are tough. And you know, the 2 coming weeks are clearly central to try and really turn the corner of this.
And obviously, that success that you are now starting to have with social distancing does have consequences, certainly economically, but also on people's mental health.
Yeah, absolutely. Well, we are starting having reports of a number of episodes and cases and higher reports on mental health status. So obviously, this has also led to more demands for the healthcare system. In some areas, really difficult to respond to because of the lack of professionals available that are used in the territory for other COVID more stringent emergencies, and also a number of other social issues related to domestic violence because of the schooling system being completely locked down, and so on. So it is clearly a dramatic moment for Italy, and hopefully with that lesson in Australia, we can internalize how important it is behavior in this phase where we see numbers going up and at the same time the rates going down. It's critical to continue with social distancing and following the government's instructions.
And Francesco, the Easter break is just around the corner. There's concern here in Australia that people may relax to a degree. Italy, of course, is a very Catholic country and observes Easter. Do you have concerns leading into the week?
Yes, I think very much. I mean, most of the regions have, in fact, announced tighter measures. Frankly, as advisors and experts and observers, we are not sure what this may be because obviously we think we've reached the limit in terms of restrictions. But yeah, of course, a lot of elderly people have been in lockdown for over 6 weeks. We are entering the 7th weeks of full lockdown, and clearly there is a desire to spend peace and you know, to also enjoy the time with the family. So there is a serious concern, and the government has announced more stringent measures. We really can't say what they will be.
And Francesco, a lot has been reported on the high fatality rate in Italy. Does this all come down to that high proportion of the population that are aged over 65?
Well, look, I think in Italy, yeah, the median age has been for a long time over 80. To be fair, it's related also to individuals that have a morbidity or comorbidities, so that suffer, for example, for cardiovascular conditions or COPD and so on. In reality, what we are observing more and more is that the number of people in lower age brackets is increasing, and they need the same care. So intubation, ICU, intensive care 24/7 and for a prolonged period of time. I would say the intensity of the wave of ill individuals in severe conditions, which also is an indication of the degree of severity of the transmission. So if the disease is contracted by a person from a person that has a severe condition, it's likely to be as severe. That has really crippled some of the northern regions. And obviously, you know, now that we are seeing slowing these numbers down, we are also expecting to see you know, more and more room for emergency cases, and also to be able to treat people in a more stable way without having to make, in some instances, very difficult treatment choices.
Professor Francesco Paolucci, thanks very much for joining us.
Thank you. Good evening.
Americans